Families, Women, and Children, Single-Parent Households, Alexandria K. Duran, Indiana University, Purdue University, Indianapolis. A social problem is an issue that affects a considerable amount of individuals within a society. Social problems affect a select population who is suffering from an unmet need detrimental to their community, environment, or well-being. The area of human need or social issue on which I focus is low-income single parents, the inability to make enough money to provide for the family due to a single income in the household. Single-parent households are at risk for experiencing lack of housing, food, or childcare due to low income. The city provides single-parent households with the opportunities to further their child's future by eliminating everyday stressors and providing need-based assistance. Low-income single-parent households' need for government help and the service delivery system that addresses the need for cash assistance is the major function that I am researching for my social delivery system project. Stopping a social issue from arising and becoming overwhelming is prevention. Prevention is the key function in the service delivery system. Maintenance and advocacy are also important in keeping the lights on, food on the table, and roof over the family's head. The system strives to provide financial means to aid the family in times of high crisis due to poverty. By creating awareness in the public and advocating for these individuals, the government and City of New Haven can help multiple families eliminate poverty on the streets. Here you will see that the system is composed of private, public, and voluntary sectors that aid low-income single-parent households' need for cash and aid assistance. In this service delivery system, prevention is the key function. The system provides preventive measures for single-parent families from at risk of hunger, homelessness, lack of child needs, etc. The components in the private sector include American Electric Power and Fort Wayne Housing Authority. AEP helps fund emergency shelters and food programs. They also help pay a portion of utility and heating bills in times of needed assistance. The Fort Wayne Housing Authority offers affordable housing to low-income and working poor. Federal grants, temporary assistance to needy families, Supplemental Nutrition Action, Community Action of Northeast Indiana, Women's, Children, and Infants, neighborhood health clinics, and the Township Trustee aid families in the need of housing, food, health, and other necessities. There are also programs that can help assist families with child care needs such as Step Ahead program and Y-sponsored programs. The voluntary sector is made up of the United Way of Allen County, Catholic Charities, Broadway Christian Church, and the Fort Wayne Salvation Army. They offer emergency assistance with rent, housing assessments. The basic services include food, shelter, and health care aid. The system strives to provide financial means to aid the family in times of high crisis due to poverty. The public, private, and voluntary sectors all interact with each other in order to provide the best possible aid to the community. By creating awareness in the public and advocating for these individuals, the state government and the city of Fort Wayne can help eliminate poverty of multiple families in the area. The population of low-income single parents and their families are the inputs into the system. All applicants who desire aid must meet the following eligibility requirements: provide proof of residency, countable income, basic needs defined, countable assets, having or seeking employment, shelter documentation, utility service and heating fuel bills, transportation needs, and/or health necessities. The township trustee collects all of the information from the client and provides referrals to the organization that can provide support. Benefit levels of the inputs include funds, housing, and food. In order for the system to operate effectively, the public policies put in place to aid families need to be maintained. Private, public, and voluntary sectors are helpful in providing financial resources to low-income single-parent households. The laws and statutes provide opportunities to create and re-examine existing policies to help people in poverty. Population trends, public opinion, program implementation, and cost sharing can create opportunities and constraints for low-income single parents. Opportunities include Title I, food stamps, government-assisted housing, Medicaid, welfare, unemployment benefits, etc. Constraints include public perception stigmatizing, government assistance, limited funds available, lack of proper housing, etc. I expect the low-income single parents and children be provided with the funds necessary to live. According to Brown and Spare, 2003, one-third of poor Americans are not eligible to receive this help already. Knowing they have enough money to provide what is needed for their children will be a relief. The system uses prevention to avoid single-parent families from turmoil. By developing a more consistent plan for helping low-income families with finances, the parents can focus more on the family. It is important to research the public, private, and voluntary sectors and what they are providing the services they claim. Are the clients receiving enough help to cover all needs? Are the families able to get out of poverty, or are they kept at the poverty level? This feedback needs to be collected and provided back to the organizations, policymakers, and the public to ensure every low-income single parent has the means necessary to survive life. No matter what family a child is born into, they should not go without everyday needs. Single-parent households should have the opportunities to further their child's future by eliminating everyday stressors and providing need-based assistance. In looking at trends, it is important to look at the past and present, which will yield the future. Data, including the U.S. Census, grant proposals, and vital statistics, are helpful when determining the trends. According to the U.S. Bureau of Labor and Statistics 2004, there were over 7 million working poor persons in the United States, and about 28% of single mother families are poor, according to the U.S. Census Bureau of 2005. These numbers are extremely large. Resources available, government policies, and the consumer population impact the system components. If a single parent cannot financially support their families, the family ends up in financial dependence from the government. Cabrera, Mitchell, Ryan, Shannon, and Timberland Model, 2008. There are government policies put in place to help those in need by providing families with rent-controlled housing and welfare opportunities. The government cannot support the masses. They do not have enough resources available to bring families out of poverty, but instead sustain life in poverty. Therefore, poverty is a major problem in the United States today. According to the U.S. Census 2013 data, for a family of two people, including a child, the poverty threshold is $16,057. In the state of Indiana, the minimum wage is $7.25. If an individual makes minimum wage, this would only equal $13,920 in yearly income, therefore placing the family under the poverty threshold. According to Holman Marriott 2009, a family's economic status is lower due to single-parent involvement. Without two main providers, children find themselves in poverty. Nevertheless, support systems such as government, state, and local organizations can aid families in this type of need. Cabrera et al., 2008. With such a large number of impoverished families in society today, the government is unable to provide enough assistance for everyone. Most families need more than what the law mandates they receive. More and more individuals and families are dropping below the poverty level every year. In order to aid my SSDS project, I held a community dialogue. New Haven Citizens Economic Difficulties Dialogue Group. New Haven citizens interested in discussing issues of low-income single parents and services the city offers to persons or families in the community were invited to participate in an open dialogue. The purpose of the dialogue was to provide feedback about present services and policies Adams Township trustee practice. The feedback will be used to develop recommendations to the trustees and the community as part of my service delivery system analysis. Members for the dialogue group were recruited through a posting at the New Haven local library, New Haven Parks Department, and local supermarket. There was a comparable amount of females and males who participated. The participants' ages varied and were all residents of Adams Township. There were 10 participants in the dialogue group. 6 females and 4 males participated. Their ages ranged from 20 to 24 to 60 plus. Their demographics are on this slide. All participants were Caucasian. The dialogue group was held at Drury Pool, a local aquatics facility, in their conference room. The room was reserved for 2 hours on July 25th from 4 p.m. to 6 p.m. Refreshments included soft drinks, and access to Drury Pool's concession stand were also included. The refreshments were on a side table near the sign-in sheet. There were 8 tables set up with 2 chairs at each table. They were in a square with the tables all facing inwards to the rest of the group. The venue was comfortable and provided a successful environment conducive to the group. The purpose of this dialogue was to get community members' perceptions and opinions of the growing trend of more low-income single parents and how the community is supporting this population. The number of low-income families in New Haven is growing rapidly. So what are their struggles in life? What are their triumphs? Below are the list of the 6 questions discussed during the dialogue. Number 1. Have you yourself or someone you knew had to deal with parenting on a dime? How did they accomplish this? Number 2. Consider single-parent households. Do you think single-parent families struggle more on one income? Are there any aspects of single parenthood that could be difficult? Number 3. Let's discuss the average family's expenses. What kind of helps would a struggling family need? Number 4, do you know where you or struggling families could get food assistance, help with rent, or electrical payment aid? Number 5, do you feel there is a stigma on the parent or child who accepts aid from the city, state, and or government? Number 6, do you know of any services the Adams Township trustee offer as assistance? There were many key points and opinions that came out of this community dialogue. The group stated many concerns pertaining to single parents with a low income, such as house rent costs, transportation or car needs, electrical utility and phone needs, child care, discipline, etc. They also discussed many types of local and government aid, Social Security office, food stamps, CANI, food banks, medical help, etc. I found it very interesting that many of the participants did not know what the Adams Township trustee was, let alone what they did. I explained to the participants that did discuss many of the programs they offer: federal grants, temporary needy assistance to families, supplemental nutrition assistance, community action of Northeast Indiana, women, infant, and children, neighborhood health clinics, and the township trustee family aids in needs of housing, food, health, and other necessities, just like the others. One of the participants works at the Adams Township trustee and was able to enlighten the group on exactly what they did offer. The fascinating opinions that we shared opened my eyes. Some participants believe there is a stigma in accepting help from the local and governmental aids. Others think there is not enough of a stigma and people abuse the aid. This created a small debate within the dialogue session. People's viewpoints helped us see the world in a different light. This discussion did just that. Overall, the group fed off of what others said. They were able to get through the first 6 questions in the 90 minutes. And since the room was still reserved, I did decide to introduce 2 extra questions. There were many successes and challenges in this group dialogue. Personally, I brought listening skills to the group conversation. In order to get the most out of what the participants are discussing, I wanted to fully listen to what they were saying. I am also good at getting more out of the question than a simple answer. By asking the what, why, when, where questions, I was able to continue the conversation by examining the questions more in depth. Many challenges also were discussed in the discussion. I believe that the group was hesitant to speak out about this social issue. It's not an easy subject to talk about, and the group did not want to step on each other's toes or opinions. As the group discussed the first couple of questions and then became more and more comfortable with each other, we continued to go back to questions and discuss them more in depth. Some questions were more difficult to answer than others, and I could see the looks in their eyes and the tone in their voice. They have witnessed low-income families themselves, and they've had to be on a budget or plan. The dialogue group will influence my advocacy project in many ways. I am setting low-income single-parent households' need for government help and the service delivery system that addresses this need for cash assistance. Single-parent households are at risk for experiencing lack of housing, food, or childcare due to low income. The existing system in my community that serves the population of low-income single parents is the Adams Township trustee. The city provides single-parent households with the opportunities to further their child's future by eliminating everyday stressors and providing need-based assistance. This community dialogue will be used as a tool to aid the Adams Township trustee. The answers and opinions of our public are very important. Considering most of the participants did not know what the Adams Township trustee is nor what they did, I believe that the dialogue suggests to them to advertise and market themselves, to explain to the citizens that they can help and how. In conclusion, considering there is a large amount of impoverished families in society today and the government is unable to provide enough assistance for everyone, this dialogue, this community advocacy project, and our social service delivery analysis are important. It highlights public opinion, discusses opportunities that the public sees and does not see, and emphasizes public perception of the low-income single parents. Most families need more than what the law mandates they receive. More and more individuals and families are dropping below the poverty threshold every year. Public views and thoughts are imperative to implementing change. I believe that their summary and opinions are important to share with my community partner. These results could yield a change in how things are done or what they offer to the community. Dialogue groups are important for future applications.